Good evening. My name is Dr. David Doman, and welcome to another edition of Housecall. What's new with the African American Health Program? Find out right now. My guest this evening is Arlee Wallace, the Director of the African American Health Program. Ms. Wallace, welcome to Housecall.
Thank you for having me.
Briefly, tell our viewers about your professional background.
My professional background actually started about 15 years ago in public health. I worked for the state of Maryland, focusing on chronic diseases across the state. If you may not have heard, but that was with the time of the Cigarette Restitution Fund program. Mm-hmm. I put together and managed a program that was called the Minority Outreach and Technical Assistance Program. That was my public health for like 13 years worth. Then about 2 years ago, I decided to switch positions. So I applied for a job here in Montgomery County with the African American Health Program. Congratulations. Thank you.
So let's focus in broad terms then on Montgomery County. In terms of, we have a population of roughly 1 million people. Mm-hmm. What is the African American population within Montgomery County?
The black African American population is roughly about 170,000 population,
okay.
Based on the census of 2010.
Mm-hmm.
Now, according to the American Community Survey, which is undertaken, it looks like it may have gone up. And it may represent roughly about 18%. So we would imagine we may be right at about 180.
Right.
But we'll have to wait until the next round of census.
Sure. Now, what is your view of the 180,000, let's say, African American members? How many are native born to the USA, and how many are blacks from other countries, for example, Haiti or West Africa, etc.?
I believe of that percentage, we may have at least, I would estimate about 60-some thousand, I would imagine, that may be born from other African or Haitian places in the U.S. That has actually moved here in Montgomery County.
Right. It's a real United Nations in Montgomery County.
It really is very diverse in Montgomery County when it comes to the black population.
Right.
Yeah, from the island as well as just from Africa and other places.
Sure. Of the 180,000 individuals then, what is your estimate of the people that are uninsured?
Uninsured would probably range anywhere from maybe, if I count all, anywhere from maybe 20 to maybe 30,000 that may be uninsured, and that would include both adults as well as maybe potentially some children. Mm-hmm. And that could, that's my estimate based on those who are documented as well as some that may not necessarily be documented individuals.
All right. And then from a humanitarian standpoint, looking at these 30,000 individuals that may not have adequate health insurance, what is your sense about the healthcare disparities that result from this situation?
Well, the healthcare disparities from that population is really pretty somewhat gruesome. If you look at the black population, even here in Montgomery County, despite our wealth, blacks still have some of the highest and poorest rate when it comes to cardiovascular disease, diabetes, hypertension. Our infant mortality rate just here in Montgomery County is like 9.9%. That's twice as much in compared to white and even the Latino population.
So why do you think there is that disparity?
I think we have that disparity because of lack of quality access of care, individuals being uninsured, mm-hmm. Not having adequate number of professions who may even accept certain type of health insurance mm-hmm. benefit, which individuals have, as well as others who just do not know or have access to go and receive the treatment and care in which they need.
Do you think there are any lifestyle issues as well for the community that contribute to some of the higher incidence, for example, of heart disease, diabetes, high blood pressure,
Well,
etc.?
there are some lifestyle issues that we're trying to address. That could include anything from being able to move and being active. That's one reason why we suspect that obesity is somewhat high. I would also say it's based upon the availability of fresh, healthy produce in our grocery chains across the county, as well as probably having in some areas where you may not necessarily have the physical equipment or even the safety of lighting, which will allow one to be able to have the freedom to walk around in their neighborhoods.
Tell me more about the infant mortality. That's kind of shocking considering we're one of the wealthiest counties in the country, and yet a subset of our population has unacceptably high infant mortality. Why is that?
Well, that is a mystery that we have yet to be able to understand what. Some individual will say it has something to do with the high stresses in which the black population encounters. Some would say it also has to do with basic racial discrimination, also poor and maybe adequate housing, the inability for some to be able to be eligible for certain type of services, say like for the WIC program. In some cases, everyone do not necessarily have access to that based on their income.
Explain to the viewers what you meant by that program.
WIC is actually for women and infant and children. That's a program that one could receive if they're eligible based upon their income.
Do you feel that children, for example, are not getting adequate vaccinations, and that's also contributing?
Well, at this point, the vaccination rates are not that bad, that I am familiar with. So I would not necessarily say that the rate of infant mortality is related to vaccination rates whatsoever. I think it's more of an environmental issue that may be dealing with, as I said, like in some cases, the unemployment can be higher for certain black population than others. That within itself could have an influence and impact which restrict one from being able to go in to get the adequate services that a pregnant expectant mom would need. Also, maybe even the isolation from your parents or from your loved ones or even from your family members as a whole, based on the fact how diverse the black population of Montgomery County is, that those could also contribute.
You mentioned earlier nutrition. What are some of the nutrition challenges in the community?
I think some of those challenges that we have with nutrition is that all of our various stores, despite the fact they mean well, they don't necessarily have the prices that one can always afford. And then if you look at how persons have to pick and choose between, do I buy the healthier, fresher products, as if they're available, versus those that may be maybe the canned type of things. Those also will impact the nutritional value that one will have access to.
Do you think, though, there is also a need for better education, eating healthier?
Oh, definitely. Education is always one of the key things in which all individuals across any race or ethnicity need to always benefit from.
Sure. Let's go from one extreme, infant mortality, to adult healthcare disparities. Specifically cancer screening. What are some of the challenges you've encountered with the community in terms of being receptive to cancer screening? For example, breast cancer, colon cancer, pap smears for women, etc.
Well, I think things that we've been able to encounter so far is that most individuals have no idea where to really go, in some cases, to receive those type of screenings. And then secondly, is being able to try to get on some of the health professionals' calendars, because trying to get on a list to go in for those appointments can be months out at a time.
Right.
And then just based upon the makeup of the family, those may inhibit one from really going out and get the needed screenings that they need.
What do you mean by the makeup of the family? You mean the family is resistant? Or?
No, not the family necessarily resistant, but it's just a makeup if you only have like a one-parent head of household.
Right.
And it's strictly a female head or even a male head.
Right.
They may not be in a position they can go out and really get those preventive screenings that they need based on the fact it's one income.
Right.
Their job may not allow them to earn annual leave or any other form of leave.
Right.
Therefore, every dollar counts for that particular family. So those type of structural issues that based on one's employment status could impact the ability to get that.
Do you find that within the community there's any, if the opportunity is there, that there's any resistance to getting the screening?
Oh, no. I think based on the fact that there's been limited amount of funding really for years. At once upon a time, there was funding that was available. But due to the cutbacks that has occurred, those free screenings or a reduced type of payment plan options are basically non-existent. So if individuals can and have the ability to get there, I think folks would definitely go. Right. But it's a matter of knowing and really getting the word out. And then the fact that if those resources are exhausted so quickly, that it's hard for everyone to be served off such a small amount of funding that's available.
The reason I asked that question is that I've had the pleasure of interviewing your counterparts with the Asian American Health Initiative, the Latino Health Initiative, and there is different types of reasons for resistance to get screened. Mm-hmm. For example, unfortunately, members of the Latin community are afraid if they go in for screening, they might be reported to the immigration services and deported, which is very unfortunate. And the Asian American community has misconceptions about the screening, what it means. So every group seems to have their own challenges.
And there is somewhat some of those challenges within the black population, especially if you happen to have a person who is here and they are an African immigrant.
Right.
Then they could be thinking of the same thing. It's a sensitivity of disclosing my status here in the U.S. Okay. So those things could exist. I don't know if they are as prevalent as other groups. I just think it's more or less lack of the availability of it, which one could afford.
What is your sense about the effect, the benefits of the Affordable Care Act, Obamacare, on the community once it was passed?
Well, the Affordable Care Act was great, I think, for the black community. That was part of one of the main initiatives when I started, that I actually worked with the African population in the community, as well as the Caribbean population and African American born, to try to encourage everyone who was eligible to really go out and to seek and to apply and to follow through. I must say it's somewhat more complicated for one who may not be a U.S. citizen, because those individuals have to really come into the office to bring in various forms of documentation in order to be deemed eligible.
Right. Is it your sense, though, that they did indeed take advantage of it?
Most definitely.
Yeah.
There was indeed an increase. The numbers yet still are somewhat inconsistent with finding out who did and who didn't, because we don't necessarily have a breakout of all of the various subgroups of blacks. But I do understand that there was indeed an increase, but it wasn't an increase at the level of probably those who are really eligible. So there's still work to be done.
Of course, of course. Is it your sense, though, for example, that cancer screening improved with the Affordable Care Act? Infant mortality was reduced with better access?
At this given point, I don't see where infant mortality have really shown to have any huge significant impacts yet.
Really? Yeah.
Yeah, and I think that's just part of what's happening in the environment. Because if you look at infant mortality, it can go down a particular year in some cases. And there was a point in Montgomery County, I think it was back during the I think it may have been like 2009 or 10, that infant mortality actually dropped a little bit in Montgomery County. But that could have been related to an infusion of different types of funding that was coming to the county from different venues. So whenever you do not have adequate amount of funding to really educate, do screenings, and have different type of techniques in the community that could be applied to different population, then you could certainly see a change in those numbers. And it's also based on what's happening. I mean, you have to think of the wars that's going on, the loss of jobs that has been taking place over the years. All of those things can impact not only infant mortality, but other forms of chronic diseases that impacts families and communities.
So conversely, given that on Capitol Hill now there's talk about repealing the Affordable Care Act, what are your thoughts?
It's my thought that would be very devastating, because so many individuals have benefited, so many individuals who need to have the coverage for not only just dealing with their chronic disease, but substance abuse, mental health, the free screenings opportunities that are offered through the Affordable Care Act. That would be very, I think, critical, and it could really turn into more of a catastrophe if we're not careful without adequate coverage for individuals who are really most at risk.
All right. Well, we are going to pause briefly for a public service announcement. When we return, more with Arlee Wallace, and we'll be discussing the African American Health Program. We'll be right back.
The odds of this boy achieving his dream in fashion? 1 in 23 million. The odds of having a child diagnosed with autism? 1 in 68. I am Tommy Hilfiger. Learn more at autismspeaks.org/signs.
We're back. My guest this evening is Arlee Wallace, Director of the African American Health Program. So, Ms. Wallace, at the break, we made the case for the viewer that there are healthcare disparities for the African American community in Montgomery County. Let's then focus in on your program, the African American Health Program. When was it first developed?
The program first developed in 1999. And it was really based upon infant mortality. That was something that then U.S. Surgeon General David Satcher actually was in the community talking about I think it was the 2010 Healthy People he was talking about. And he was the one that really disclosed to Montgomery County employees and the community at large how devastating Montgomery County numbers were when it came to infant mortality. So after he actually talked about that, the group that was in the audience, which was made up of county employees as well as community citizens, came together and decided they wanted to try to form some type of program to focus on the black population. And then after, I think almost like a year or so of talking and community forums and some other activity, it finally came into existence. And the program was put in motion. I believe it was like in 1999, as I said, but it started back in 1998, the discussion.
Wow, how exciting.
Yeah.
Yeah. So what is your current mission statement for the program? What are the healthcare disparities you're trying to address?
We're currently trying to still address infant mortality, diabetes, cardiovascular disease, HIV/AIDS, cancer, as well as focusing on mental health now. So those are just some which we're focusing on.
That's a very ambitious agenda.
It's very ambitious.
So let's touch upon each of these as time permits. Infant mortality, what kind of programs are you offering to address that?
For infant mortality, we actually have a program that is called Starting More Infant Living Equally Healthy, and we normally call it SMILE. That is a program that has a different diverse number of nurses of different level of credential who actually provide nurse case management to black women, residents of Montgomery County, who are 28 weeks or less pregnant. And then we follow them throughout that pregnancy to making sure they're doing all the things they need to do to have a healthy baby. And then after the child is born, we follow them for an additional year in which we provide services and look at the developmental growth of the infant or infants in some cases if we have multiple births. And we do everything with that program from putting on car safety seats, showing them how to really have your baby to sleep on its back. So we have those community type groups, community type settings where we actually invite our participant and everyone else in the community who would like to come out to take advantage of those sessions that are put on. And then we also teach safety car seat setting to make sure that they do have the car seat, know the proper way to use it, as well as going back into the home, making sure that we have the cribs are properly set for the infant to be in the crib on his or her own with nothing in the crib but the baby to keep him or her safe.
Almost a parenting class.
Exactly. You can call it a parenting class. It's a good little support group to try to get everyone ready for the new baby that's coming home.
And the new mother.
And the new mother and the new dad.
Right.
I mean, because those are not just offered to moms.
Right.
We want the partners to come in.
That's wise.
Yes.
Cancer screening, what are you offering?
Well, with cancer screening, we really do a lot of education on cancer screening. We're trying to provide information on that itself. So we'll provide and talk about the need of having their preventive things for, like, say pap smear, males prostate screening, going in for that, as well as breast cancer awareness and screening for our women. Those are our key primary ones that we have. And then we deal with oral health as well, was trying to educate individuals across the spectrum, no matter what issues that they have, about having good oral health, because we know it's connected to your overall well-being.
I can't resist to point this out that you did not mention colon cancer screening.
Well, not like I didn't mention. Well, we will talk and have services on different forms, but colon cancer is not necessarily one that we have focused always on. We're starting to broaden that, but it is just one of those type of diseases, cancers, that we are and are trying to bridge and to educate people on. And that's the one issue that we work closely with the Cancer Crusade to try to direct individuals to that services. But in our office, all we can do is just do the education component and then refer them out to the county for those services.
Well, I'm a gastroenterologist.
Okay.
So let me add something that you may want to consider for your educational component.
Okay.
We routinely, as gastroenterologists throughout the country, suggest that everyone, when they're 50 or older, get their first colonoscopy, just for preventative screening. Unfortunately, in the African American community, there is a higher risk of colon polyps, which are precursors to colon cancer.
Okay.
So as a result, the American College of Gastroenterology, about 5 years ago, changed their recommendations, and the new standard of care is that members of the African American community should have their baseline, their first colonoscopy at age 45. Wow. So my suggestion when you're educating members of the community, if you bring up colon cancer screening, and let's say somebody is 48, and they say, oh yeah, I'll get that done when I'm 50, you should say, no, that's not correct. For members of our community, it should be at age 45. Okay. And you mentioned the Cancer Crusade. Charlene Holt and I have discussed that as well.
Okay, yeah. Wonderful.
What about diabetes programs and education? What are you doing there?
Well, with the diabetes program, we currently have a 4-week program. And it covers everything from understanding your diabetes to trying to control it, introducing nutrition and exercising. That is a program that takes place throughout the county. It is offered in the higher Black concentrated communities at our community centers. Mm-hmm. And at one point, we will also take that into some of our faith-based entities if they're interested in us.
Churches.
The churches, correct.
Yes. Yeah.
Correct. And then on top of that, at that program, we're doing everything from screening individuals on site with the A1C test.
If you could explain to our viewers what you mean by the A1C test.
Well, that is just to actually test individuals for the level to see if there's any risk of them being a high risk for diabetes.
Pre-diabetic, right.
So that's part of the process that we offer out, as well as then trying to show them the techniques and how to check themselves periodically at home. That also includes checking their feet and making sure they're properly taking care of that, as well as going in and having a vision checked on a periodic basis. So it's part of the whole education piece. And then after we finish that 4-week program, we have individuals who will come back like 90 days, because we try to understand, are they learning anything from the program? So they'll come back in about 90 days, and then we'll go and see, have there been any behavior change that is staying in place? What have they done? Are they maintaining, are they losing weight? Have they had any of their medication reduced or adjusted in any way? And have they changed any of their physical activities?
And if I can interject for our viewers, the reason you mentioned a diabetic checking their feet frequently is that unfortunately diabetes is the leading cause of amputation in our country due to poor blood flow. So a small foot ulcer can blossom into a gangrenous foot, which can lead to amputation.
Yes.
Yeah. Do you have a program for high blood pressure, hypertension?
Actually, with our hypertension program, we have what's called our heart health program. Okay. And that's running almost been like a 2-week program where we still try to get individuals moving, but we still go in and make sure that before they start moving that they've gotten the okay from their doctor. Because every level varies just based on the individual's health and ability. So we do offer a similar type program that we actually have now started to infuse physical movement. So we were fortunate to have what we call a go-go fitness professional person who actually came out. And she actually did this for 4 weeks.
Right.
And working with the group and the population and then understanding how we can move, even sitting in our seats to do some types of exercises. So I don't think that they have to feel that you have to be able to stand and be mobile, but there's a certain type of movement you can actually do by just sitting in your seat, as long as you try to get them to move to the best of their ability. And that program is one that, takes place as well in some of the same locations as well. And it has blossomed for the first time because we finally are putting true physical movement in the class. Other than just teaching someone some basic, we're moving, we're bringing the tennis shoes, and they're enjoying themselves while they're improving their health, we feel.
Wonderful. Are you offering anything from a psychiatric standpoint?
For the first time, the African American Health Program did not have a true mental health component, but in 2017, we actually were fortunate enough to be able to receive funding to have a licensed clinical social worker board. That individual is working with individuals from our expected moms to our individuals who are faced with diabetes or have cardio health issues, or even those who may have been tested positive or not for HIV or AIDS. So we now have a program that's being offered for the first time. It's in developmental stages, but it has been really good and received quite well by our recipients, so that they could understand that we can even acknowledge the emotional difficulty it is to try to get a handle on so many medical conditions that one is faced.
You mentioned HIV/AIDS. Besides the counseling, what else are you offering in terms of support?
Across the county, we offer and have set up different type of screening tests for HIV throughout the year. We're at the local health department, at the local colleges, at shelters. We've gone to senior citizens building and facility, and we've even offered that at some of the churches as well, who have allowed us to come in. And that's when we actually have the testing available. It's always secured and confidential, that we have persons to come in for that, and then we'll be prepared to counsel them based on what the results may turn out to be there.
Are there any parallel programs to this statewide?
Not necessarily with how our program is structured. There's none that is parallel. You may have some that have bits and pieces of it, but not across like the African American Health Program is covering.
Well, good
This
for
is
you.
a unique program.
And you mentioned briefly funding. What are your sources of funding to sustain the program?
The only source of funding we have come from the county general funds. So it's based up on the county council as well as the county executive, seeing that there is a need and a benefit of this program to continue.
And my sense is that you've been able to demonstrate that value over the years.
Yes, we have, most definitely.
Have you sought out support from private industry?
Well, I am starting to work on that piece since I've been aboard, because I know that's one of those missing things that we think that can really help to complement our efforts. But we have yet to be able to get private industry to support. But at one time we did have state funding support that was made available for a set amount of time based on a demonstration program. And so as fundings kind of dry up, we have to try to keep looking for other revenues to bring in new type of practices we can do to impact health disparities.
Good for you. Briefly, how does somebody qualify for your program?
You qualify simply by being a black resident of Montgomery County. There is no income eligibility requirement for our program whatsoever.
How about citizenship? Is that a requirement?
Citizenship, we do not ask. We just simply want you to come in. If you are within the black or black ancestry population, come in. That's our primary target population. If other wants to come, there also is opportunity for them as well.
Ms. Wallace, thank you for joining us on Housecall.
Thank you for having me.
My thanks to Arlee Wallace for an excellent interview tonight about the African American Health Program. My thanks to my team here at the studio, but most important, my thanks to you, the viewer, for making Housecall the success it has become. Let us know how we're doing. You can reach me at my practice website, montgomerygastro.com. As for our next show, it's going to be a fascinating program. We'll be discussing acupuncture and its many potential uses in healthcare. See you then next time for another edition of Housecall. Good evening.